Hello from Florida. I'm Dr. Rachel Tate for RheumNow.com, covering ACR Convergence 2021. I know that I have harped on this before, but treat to target in psoriatic arthritis is something we desperately need, and it significantly challenges us in rheumatology. We continue to work on this area to better define disease activity targets for patients. And my friend Dr. Alexis Agdi et al. In abstract number 1344 looked at the association between MDA achievement and disease activity and patient-reported outcomes after 6 months of biologic therapy or CSD-MARD therapy in psoriatic arthritis patients. So this was part of the core EVITAS, and it was a study of 1,251 patients. MDA, as you know, is defined as an achievement of greater than or equal to 5 of the following: a tender joint count of less than or equal to 1, swollen joint count of less than or equal to 1, BSA of less than or equal to 3%, a patient's assessment of pain of less than or equal to 15 on a 100-point VAS, patient's global assessment of disease activity of less than or equal to 20, a HAQ-DI less than or equal to 0.5, or a Leeds enthesitis score of less than or equal to 1. So MDA was achieved in 22.8% of these patients. Again, these are PSA patients who had been on appropriate therapy for 6 months. So what's interesting to me about this is that those patients who achieved MDA tended to be younger. They tended to have shorter disease duration. Interestingly, were less likely to be female, less likely to be obese, and less likely to have a history of depression. DMARD therapy at initiation was similar between MDA achievers and those who did not achieve MDA, except that more achievers were biologic naive at baseline. Patients who achieved MDA were more likely to maintain their initiated treatment with sustainability throughout the duration of this particular study. What this study highlights for me is that MDA is an option for patients, but these are low levels of achievement. Less than 25% of the patients in this study achieved MDA after 6 months on targeted therapy. So we need to better educate ourselves. We need to be more aware of potential patient-reported outcomes, confounding situations for the patients, including things like depression. And of course, more treatment options will be helpful for us to achieve MDA in these psoriatic arthritis patients, but we need to be aware first. For more ACR Convergence 2021 coverage, check us out at RheumNow.com. And of course, please follow me on Twitter @UpToTate.